Hello, my name is Amanda Cervantes, and in this presentation, I will cover information regarding the emerging Hantavirus Pulmonary Syndrome epidemic caused by the Nombre virus in Southern California. While there have been no current cases related to this incident, I will address the disease geographic distribution, prevalence, its epidemiology, and how it is transmitted. I will also identify potentially affected populations, applicable prevention and control measures, as well as the proper actions that the health department will take if a hantavirus outbreak is suspected. Prior to May 1993, hantavirus-associated disease was not known in the United States. It was at this time that a cluster of previously healthy residents living in rural areas of the Four Corners region in the southwestern United States died of acute, unexplained respiratory distress. This distress was identified as Hantavirus Pulmonary Syndrome, also known as HPS, which will be the focus of this presentation. There are more than 20 identified genotypes of the hantavirus. However, the Nombre virus is the most common cause of HPS, especially in the United States. Nombre virus causes Hantavirus Pulmonary Syndrome. Hantaviruses of the genus Hantavirus and family Bunniaviridae are a group of antigenically distinct RNA viruses carried in rodents and insectivores, such as shrews and moles. Each hantavirus is endemic in at least one or a few specific rodent or insectivore hosts to which it's well adapted. At least 20 hantaviruses have been identified, but estimates of the exact number of viruses vary. Newly identified hantaviruses are often named for the location where the virus is found. However, some of these viruses are later reclassified. The majority of HPS cases in the U.S. are caused by Nombre virus. In California, the deer mouse is the principal reservoir and the vector of Nombre virus, the most important cause of this disease in the United States. Although rare, Hantavirus Pulmonary Syndrome has a 50% mortality rate. Hantavirus outbreaks are often associated with increased rodent populations or environmental factors that lead to increased human exposure to rodents. Nombre HPS is seasonal, with peaks lasting from late spring to early summer. It is associated with the deer mouse and is found in regions where the deer mouse is common. Because of where Nombre infections confirmed in California rodents in 2015 and 2016, regular surveillance has been conducted annually. The table shows the serologic evidence of hantavirus Nombre infection in California rodents from 2006 to 2015. In 2015, you'll see that 15 of 60 deer mice tested positive for Nombre virus antibodies. Outbreaks usually appear in clusters and are associated with increases in deer mice. Currently, there's no documented human cases of hantavirus pulmonary syndrome originating within Riverside County. However, there are currently positive rodent cases. 2 out of 11 rodents collected in late December 2016 from the Santa Mateo Canyon at the Norton Younglove Preserve near the city of Beaumont, California, have tested positive for hantavirus. The California Department of Public Health confirmed the mice that that Riverside County environmental health officials submitted have tested positive for the virus. Over the past decade, approximately 10% of the rodents collected in Riverside County have tested positive for hantavirus. This is fairly consistent with the average for California. Occupations that may be at higher risk of infection include rodent control workers, farmers, forestry workers, and military personnel. Activities such as camping or staying in rodent-infested cabins can also increase risk. Rodent contact is an important factor in the transmission of this virus to humans. While infections can be spread between rodents and aerosols and via rodent bites to one another, rodents can also shed hantaviruses in saliva, feces, and urine. Infected animals can carry these viruses for weeks to years and can sometimes be infected for life. Transient infections are also possible. Humans can become incidental hosts when they come in contact with infected deer mice or their excretions. It is spread to humans through contact with rodent droppings and urine. Humans are infected through direct contact with excreta or the aerosolization of rodent urine. Infection occurs particularly due to sweeping in rodent-infested homes or contact with fomites, such as contaminated blankets or food storage areas. Most cases have been traced to inhabitants of closed, rodent-infested homes. When rodent urine, droppings, or nests are disturbed in enclosed areas, the viruses are then inhaled in aerosolized dust. Infection can sometimes occur after only a few minutes of exposure to aerosolized virus. Hantaviruses can also be transmitted through broken skin, the conjunctiva, and other mucous membranes by rodent bites and possibly by ingestion. Person-to-person spread has not been seen in HPS cases in North America. Infected rodents do not appear to show any signs of illness, so it's important to keep from stirring up materials while cleaning up any mouse-infected areas in and around homes, especially in rural areas. The flu-like symptoms are displayed and are very severe. Hantavirus pulmonary syndrome is an acute viral disease associated with rapid onset of respiratory failure and cardiogenic shock. The incubation period is approximately 1 to 8 weeks, and there are 3 stages of HPS. The 3 stages of this virus are the prodromal, cardiopulmonary, and convalescent. The prodromal phase is an acute febrile illness with temperatures greater than 101 degrees Fahrenheit that lasts about 3 to 5 days, and you'll have fever, fatigue, and muscle aches. Additional symptoms are headaches, dizziness, chills, and abdominal problems such as nausea, vomiting, diarrhea, and abdominal pain. Approximately half of all HPS patients experience these symptoms. The cardiopulmonary phase is approximately 4 to 10 days after onset. These symptoms include the rapid progression of shock and pulmonary edema, hypovolemia, hypotension, and in some cases death within 24 to 48 hours due to lack of oxygen or myocardial failure. The convalescent phase can last up to 2 months, and this phase usually results in chronic decreased small airway volume and diminished alveolar diffusing capacity. There's no specific treatment, cure, or vaccine for hantavirus infection. However, if infected individuals are recognized early and receive medical care in an intensive care unit, then their outcomes may be better. In intensive care, patients are intubated and given oxygen therapy to help them through the period of severe respiratory distress. Because HPS resembles influenza symptoms, it is difficult to diagnose in its early stages and is often overlooked. Differential diagnosis is required to rule out other infections. To diagnose this virus, laboratory testing should be performed or confirmed at a public health reference laboratory. Testing mice is not recommended. There's no test to determine if urine, droppings, or nesting materials are infectious. Persons concerned about exposure to such materials should monitor themselves and seek medical care if they develop symptoms. There's no vaccine against the Nombre virus at this time. The primary strategy for preventing human exposure to rodent diseases is effective rodent control in and around the home. This is achieved by eliminating any food sources, sealing even the smallest entries into homes, and successfully trapping rodents in and around the home. Rodents and their food sources must be eliminated from inside and anywhere near the home. All food and water should be stored in a rodent-proof metal container inside the home. Trash, clutter, and spills should be cleaned up immediately, covered in a rodent-proof container, and disposed. Rodent traps should be set within and around the home if needed. And finally, care must be taken to prevent rodents from gaining access to the home by sealing all openings, raising food sources, and keeping the area around the home free from wood piles and other debris. The best defense is proper hygiene and cleanliness. Infected rodents do not appear to show any signs of illness, so it's important to keep from stirring up materials while cleaning up any mouse-infected areas in and around the homes, especially in rural areas. Residents can take the following steps to reduce their exposure to hantavirus. Procedures that may aerosolize the virus, such as sweeping, should be avoided. When cleaning rodent-infested areas, ventilate the affected area for several hours before cleanup by opening doors and windows. Wear rubber gloves, disposable dust masks, goggles, and protective clothing as needed. Apply a 10% solution of bleach or household disinfectant to contaminated surfaces and allow at least 15 minutes contact time before removal. Clean affected areas with a sponge or a mop. Do not sweep or vacuum. Double bag any dead rodents and cleanup materials securely in plastic bags and seal them. Appropriate respiratory protection devices, such as a half mask air purifying respirator with a high efficiency filter, may be necessary in high risk settings, such as seldom used cabins, sheds, and outbuildings, especially those with numerous rodent hiding or nesting places. Before removing gloves, wash gloved hands in disinfectant or with soap and water. Thoroughly wash hands with soap and water after removing gloves. Then dispose of gloves and clean up materials with other household waste. Individuals having concerns about illness should contact their health provider. Avoid camping near rodent droppings, burrows, and wood piles as well. There are several steps involved in investigating an outbreak, and they do not always proceed in order. In practice, they're usually adjusted depending on the outbreak. In the current case of hantavirus, because we are already aware of the potential for an outbreak and are implementing controls and prevention measures before an outbreak occurs, the following steps will be conducted. Preparing for the investigation teams have already been identified and assigned their responsibilities. The team consists of Riverside and San Bernardino epidemiologists, sanitarians, laboratorians, and medical providers. To establish the existence of an outbreak, if the primary case diagnosis will be verified by reviewing the available clinical and laboratory findings. The initial identification of cases will be broad to include the initial symptoms mentioned earlier in this presentation. Cases will be separated into two categories, confirmed and probable. Because this virus is uncommon and may occur in 2 counties, a case control study will be conducted. Additional cases not known or reported will be solicited from our public health officials, and this will be done via social media sites and media broadcast. In addition, all county medical facilities will be notified of potential signs and symptoms to assess for and report to their county public health offices. A risk investigation questionnaire will be provided to all facilities to screen all potential cases and collect risk information. Screening forms will be collected by the investigation team members upon notification from the medical providers. Ongoing data collection will allow for trending due to the variation in length of the incubation period and the length of the virus stages. Because we're aware of positive deer rats in these counties, further environmental investigation and hypotheses are not necessary. All findings will be communicated both in writing as well as verbally across the affected county public health offices, as well as to the state public health office. And a final outbreak summary will also be provided to the Centers for Disease Control and Prevention. This concludes our hantavirus brief for today. Thank you for your time.